So hello everyone, welcome to ConverCiti Podcasts. Today we are talking about the role of the youth as well as the recalibration of politics in the age of COVID-19. And it is my great pleasure to introduce an eclectic panel of speakers from across the world, some of the sharpest minds on the planet. Let me introduce the panel before you. First up, we have Hadar Goldberg, who's from Israel. She's a student of law at the Tel Aviv University. She has been a winner at the World Universities Debating Championship, as well as a grand finalist at the European Universities Debating Championship in the second language category, as well as in English. She will also be a part of the core adjudication team at this year's European Universities Debating Championship. So welcome, Hadar. It's great to have you. Next, we have Jessica Musulin, who has managed to stay up. It's very late in Australia right now. She joins us from Australia. She is a postgraduate student of public policy at the Australian National University and also works with the government in child protection issues. Jessica has been a winner of the Australasian InterVarsity Debating Championships, and she has also been a deputy chief adjudicator at the World Universities Debating Championship. So welcome, Jessica. It's great to have you. Next, from Poland, we have Klaudia Maciejewska. Klaudia is a graduate of media management. She has been an established debater. She has been a semi-finalist at the World Universities Debating Championship, as well as a breaking adjudicator at several tournaments, including the European, the Australasian, as well as the US Universities Debating Championships. Thank you for joining us, Claude. Thank you for joining us, Klaudia. All right, and finally from India, we have Shruti Deb. Shruti Deb is a student of law, and she has been a frequent debater on the international circuit. She has been a grand finals adjudicator at various tournaments, including Hart House as well as the ANU Open. And she has also been the core adjudicator at various tournaments, including the Hoover debates. Thank you, Shruti, for joining us today. All right, so the first question that I want to get started with, and I will come to each of you in due course, is what you have made of the response to COVID-19 by your respective governments, what you have made of the responses in your respective countries. And before I get to that, one thing which I think is very interesting, given the combination of countries we have here, is that in some ways, all of your leaders have been called populists, whether they be Narendra Modi back in India, whether they be Benjamin Netanyahu in Israel, whether they be Andrzej Duda in Poland, and in certain quarters also Scott Morrison in Australia. So I would also try to get your perspective on their responses and whether or not you believe this whole populism debate is something that is relevant, right? So let me start off with Hadar. What have you made of the Israeli government's response to COVID-19, and what do you think they have got wrong? What do you think they have done well? Your thoughts?
Well, I think there are two parts to this. That is, firstly, what is the response in regards to how they are trying to help the healthcare situation? And secondly, what are the potential loopholes that it arises that they can abuse and unfortunately have abused? I think in regards to handling with the healthcare issue, most of what we've done is we have had 2 lockdowns of getting into the first during late March, and then a second one that started a little less than a month ago. And during the time between them as well, we've had several regulations in terms of, wearing masks on the street and limiting the number of interactions, schools having smaller classes, etc. I think the main issue, and what many people feel in Israel, is that there's never was an actual exit plan to any of these continuous lockdowns and limiting policies in Israel. There's no exact plan as to how we are going to be able to handle this. And before the last lockdown, the reason why we have entered it again was because we've had a massive growth in the amount of people infected. A second common criticism, which is important to note in the Israeli context, is regarding religion. I don't want to get too much into this context for people who don't know it. However, it is important to note that in Israel, about 10% of the population is very religious, and that they have a sort of a kingmaker position in our politics, because they don't align directly left or right, so every party has the incentive to cater to their specific needs. And particularly, for many reasons, they didn't want a lot of the lockdown enforcements to apply to them, because they wanted to continue praying in large groups, they wanted to still be able to go to learn Torah, etc. I don't blame them for it, because I think nearly everyone wanted to not have lockdown imposed on them. I do somewhat blame the government for actually engaging that and not implementing a lot of the policies on this population, which has led both to more infections, but also to increased hate and tensions within the Israeli context because of many people blaming this subpopulation because of their correlation with the population that is actually infected, which is also not a very fun situation to be in. A second major issue, and then I will obviously let other people talk as well, is I think, like many other leaders around the world, it has also been used as an excuse to take down protests recently, which were very rampant in Israel, all around the country, which were limited now to not allow protests more than 1 kilometer away from your house, which has led to a funny reaction of many small protests in nearly every kilometer in Israel.
Sure. And Hadar, just one more question I had in this context is, a lot of commentators believe that the pandemic has been a blessing in disguise for Netanyahu, and in some ways it has sort of revived his popularity. Is that a fair assessment?
I don't think so. I think it was very useful for him at the beginning and in many stages in order to use it as an excuse to strengthen his coalition. That is by actually persuading Gantz and his party, which was the main party in the opposition, to join the coalition under the excuse of we need to be united right now because there's a pandemic. And secondly, as an excuse to postpone re-elections for the fourth time this year or so, which is kind of convenient. However, if we actually look at the reviews, the popularity of Netanyahu recently has only been declining, which is part of the reason why he wants to postpone the elections.
Okay, great. Let me go to Jessica now. So Jessica, from your part of the world, a lot of the attention is actually being focused on neighboring New Zealand and how Jacinda Ardern has managed to cope with the pandemic. But Australia has also done a reasonably good job, hasn't it?
Yeah, I think so. I mean, I had a look at because admittedly I hadn't followed the stats super closely before this, and I had a look, and in terms of deaths per million, it seems that we're around 4 times lower than the global average, and for detection, we're about 3 times lower than, in terms of total cases. Obviously, there are some variables there, being how much are you actually testing and things like that. But there's, on balance, the stats seem to be reasonably good. And again, obviously, that doesn't necessarily compare to other similar countries, like how does Australia compare to New Zealand? How does Australia compare to other sort of Western states with similar, resources around, implementation and so on. But on balance, pretty good. I suppose the key thing then is to know what Australia has done. And I think the key thing to characterise is that Australia has a very different political system to a lot of countries who would be making uniform public health responses. Whilst the Australian government has made a number of key decisions, and the big one is basically the decision to shut our international border. So basically you can't even exit the country, let alone come into the country without an exemption. Most of the decisions around lockdowns, around how hospitals function, and, whether masks are, mandatory and those sorts of things are being decided by our states and territories, of which we have 8. So basically means that, the Victorian government can make a different decision to the Queensland government. And that has indeed been the case because there have been very different numbers in different states. So Victoria is our state that's had a very recent high increase in COVID cases. So the Victorian government had to basically institute a almost full lockdown for those residents, and that's only been lifted, I think, like as of midnight tonight, in fact. Whereas in Canberra, where I live, we haven't had a single case of community transmission for well over 3 or 4 months now. So completely different scenarios, and therefore, I guess you've had that different jurisdictional response. That being said, there's been strong emphasis on state and territory solidarity. So the Australian government has kind of initiated new structures of all the different states and territories communicating more regularly, so that I guess there is some uniformity in decision making, but obviously that can't, be perfect and has to be responsive to individual needs. I guess the other interesting thing is that different states have enacted travel restrictions between them. So it's not only that we have an international border closure, it's that Queensland is not letting any Victorian residents in, and Western Australia is not letting a lot of other residents in. And that's caused some, I guess, tension, because obviously people want to be able to access the, domestic travel for trade, for tourism, but a lot of states are saying, we don't want people from your state coming in and bringing your COVID cases with them. So that's probably characterizes some of the more unique issues that Australia has and the response that Australia has dealt with. But I'd say on balance, although maybe not quite as a strict approach as, I guess, New Zealand, for example, on balance, a pretty, I guess, still strict one that seems to have been relatively successful.
Right. Let me go to Shruti now. I don't think relatively successful would be a good assessment of the Indian response. And it was interesting when Jessica was talking about, the division of responsibilities and delegation of responsibilities between the center and the states. So what have you made of India's, let's say, not so great response and the delegation of responsibilities as well?
Yeah, I mean, Jessica was just talking about what's happening in Victoria, and I'm on a very fun Facebook group, a group where we pretend to be Daniel Andrews, which is just largely Australians complaining about the fact that lockdown is being implemented so stringently in Victoria. My complaints are just the opposite of that with India. I wish we were implementing a lockdown at all. I don't think we have been for about 6 months now, even though it does exist, but that's simply just name. I don't think there are any actual ramifications of that. And I think to make it worse, exactly what Hadar said about religious individuals and how they feel about lockdowns, except I don't think we're lucky enough to get away with just 10% being hyper-religious. I think that's a problem with the majority of the country here. And I think with the festive season beginning earlier this month, the cases are only going to keep on increasing as they have been over the past few months. I'm genuinely worried we will beat America in the next few months to come, simply because of the lack of union and state cooperation where it was most required. Even though there exist orders to go ahead and implement lockdowns, haven't been mechanized in a way that was extremely important. The fact that religious gatherings are still happening the way that they did recently across the Shera, specifically in West Bengal, despite the sites being blocked off because of the pandemic, the fact that people were still in the streets, the fact that shopping for the festive season is still such a big deal, wherein thousands are leaving their homes every day without masks. I genuinely don't have much optimism with regard to how things are going to go back to normal. Unfortunately, the government does not share my opinions. Cinema halls have opened up just 2 weeks back. Metro travel in the capital is full-fledged back on track, and it doesn't seem like too many people care about the fact that over 5 lakh people have died just in the course of the last 8 months. And I mean, it just seems really bleak right now.
Right. And how much of this would you attribute to the way in which the lockdown was enforced? Because very little time was given on March 24th when the Prime Minister Narendra Modi announced the lockdown. Very little time was given for people to actually adjust and to make plans. So what did you make of that, let's say, prompt decision?
So initially when he announced the lockdown, it was supposed to be just 24 hours because we were supposed to test out what it feels like to be at home for 24 hours. And the fact that he actually wasted that much time in giving us a small trailer of what it's going to look like, and then gave us a gap between actually going ahead and announcing the lockdown. And when he did do it, he gave people 4 hours of time and told us, okay, look, 12 o'clock tonight, we're going into complete lockdown for the next 2 weeks to come. And I say this keeping in mind that I was extremely privileged in the fact that I could come back home from my university right in time, and as did most people belonging to the startup society that we do. However, I think the worst brunt of it was obviously borne by the migrant workers. And I think this has been spoken of in abundance in the Indian context at least. I think the fact that there were thousands of people who basically didn't have homes or shelter, were not allowed to cross state lines to go back to where they were supposed to be, were placed in tents where thousands of them lived together basically without protection, and also could not have access to food because most of them do not have the level of literacy that is required to have access to the documentation which is supposed to get you that kind of food. It was extremely short-sighted. And I think the fact that majority of the privileged population chose to celebrate that was done with lighting candles because our prime minister said that would somehow help with a virus, or with banging plates because that was meant to show solidarity across the country, while so many of our people, we just let them die, not just because of the pandemic, but because of the economic ramifications of it, because of absolute state negligence. So I think I credit a lot of what's happening in this country right now to our prime minister and his absolute incompetence.
Right. So let's go to Klaudia now. So Klaudia, the Polish leader Duda, he was re-elected in July in the midst of the pandemic, right? If I'm not wrong. So what has been the reaction to his measures? How have people perceived what the government has done?
Yeah, so the situation in Poland is quite complicated, especially in the last 4 or 5 days. It's literally like country on fire and a lot of protests, and not necessarily only women, but in general, all of the people being really annoyed by the response to the pandemic. So starting from the beginning, Andrzej Duda is not necessarily independent in his decision. So a lot of people said that a lot of decisions which are made by the Jarosław Kaczyński, the brother of the Lech Kaczyński, who died in the Smolensk catastrophe, and also someone who is in the shadow and still have huge influence on the politics, but also they have majority in the parliament as the Law and Justice. So a lot of the ideas, it's not necessarily only him, but the election was very close. People were really angry that the elections happened during the pandemic, when there was no ability to like make that properly, when they waste 8 million zlotys for like correspondence election, which never happened and was postponed from May to July. So people were angry already. But in March, we were one of the first countries in Europe which introduced the lockdown. So we closed the borders very fast. We made a short first lockdown for like 2 or 3 weeks when people were supposed to sit home, and we didn't have much cases. We had one of the lowest rate and everything was great. But then in June, July, people, when the restriction was lifted, a lot of weddings happened. People go to gatherings, the weather was better and there was no much control. And a lot of people also were traveled. So with the travels was not the problem. The problem was people around, and also some people didn't wearing masks because of their beliefs that this is not necessarily, and other things. So I think the reason why we now had 16,000 cases per day, and it's constantly increasing, it's because we didn't use the good measures in the second lockdown, and we too early allow people for too much freedom without controlling. But second of all, we are not very stable economically state. So we have a lot of people who didn't have the good contracts in their workplace. We have a lot of people working in the restaurants and the branch which they decide to close. Recently, there was also huge anger created by the people who are owning the restaurants, gym places, and other that types of job, because they decide to close that, but still keeping the churches open and other like religious places, and still politicians doing like literally joke about the pandemic. So people who had positively tested on COVID, the politicians were still visiting their relatives in the hospitals, and they created another like spreading of the disease. So a lot of privileged people were going to places when the regular people couldn't. So all of this anger, and additionally lack of financial support to the branches, which they're forcing to go to the second lockdown, because now all of the restaurants are closed and people can only order food and things, which is like a lot of people working in that sector. People just get super angry, and connected that to the our break and justice system currently. So people literally forcing a lot of bills and ideas which people didn't support, including the abortion ban, which we already had high restriction law. And now when all of these people are connected and angry, this is more like a symbolic protest to stop Law and Justice to do a lot of things. But a lot of doctors are saying that we will go to harsher lockdown, both to stop the protests and spreading of the disease, and also to like try to get back on the right track. So situation is now horrible. and it's unclear if we will not introduce the next lockdown on Friday.
Hi guys, stay tuned for part 2 of this podcast where all 4 speakers talk about the impact that the pandemic has had on their personal lives, on protest movements across the world, including Black Lives Matter, as well as the role of the youth in the age of COVID-19. Do like, share and subscribe to our channel, and do not forget to press the bell icon for the latest updates. Until we see you next time, from all of us at ConverCiti, stay safe and take care.